Hello, good evening. How you day? Welcome to another session of Ask the Doctors. This program holds every Sunday by 8 p.m. to 9 p.m. Nigerian time. My name is Dr. Frederick Unigbohai, and I'm the host of the program. Now, on today's program, we will be talking about typhoid fever. Typhoid fever, what you should know. Typhoid fever. And I'm hoping that at the end of this program, everything you need to know about typhoid fever, you will get it here. We've been having this program for about 5 years now, 5 or even going to 6 years. And this program holds every Sunday. So, by the grace of God, we've always been here every Sunday from 8 to 9 p.m. So, how are you and where are you watching me from? So, talk to me. Tell me, where are you watching me from? Let's go. Let's go. Before we start our discussion tonight, I want you to tell me where you're watching me from. Oh yeah, let's go. Tell me. And we are streaming live on Facebook. We are live on YouTube. We are also live on TikTok. Do you understand? So we are on three platforms tonight, and I'm hoping that any question you have for us concerning typhoid fever, we will be able to respond to you. Now, as we continue the program today, we might speak pidgin English. So there are times, babe, do you know that live session today, I got 700 people on TikTok. I swear. So we might stream, we might speak pidgin English, and then we might switch again. You understand? So let's talk about typhoid fever. What do you know about typhoid fever? Tell me, what have you heard about typhoid fever? Now, a lot of people have been misinformed about typhoid. They have been misinformed about typhoid, and I'm trying to bring up someone. I'm trying to invite a guest. Let's see. I'm trying to invite a guest, and I'm hoping that he can join us tonight. So, what have you heard concerning typhoid? Tell me. Good evening. What do you know about typhoid fever? Ireti is watching me from Osun State. Good evening, doctor. Good life na sense. I'm watching from Osun State. I see you, Oshobo. Musa Friday says, "Hi, good evening, doctor. How can I join you on Facebook? Why do you want to join us on Facebook? You're watching me on YouTube already. So why do you want to be on Facebook? But if you want to join us on Facebook, just search for Dr. Fredostar official. Yes, yeah. Okay, so tell me, what do you know about typhoid fever? I have two doctors joining me very soon. My co-host, Dr. Israel, is going to be here very soon, and then Dr. Chukuma is also going to join us very soon. Good evening, Emmanuel. Acheson on YouTube. How are you? Oh yeah, tell me now. Which you know about typhoid? Ifoma is watching me on TikTok. Ifoma is watching from Anambra State, Akuzu in Anambra. Gracious on TikTok is watching me also. Yes, let's see. Typhoid fever is caused by Salmonella typhi. It can, it can, it can, it can, it can take away your life if left untreated for a long time. That was a nice one. I'm waiting for you. I'm waiting for you to tell me right now. What do you know about typhoid? Tell me. Oh baby, talk to me. This your for me. Don't tire me. Ahem. Vivian, what do you know about typhoid fever? Oh yeah now. Oh God of heaven, these people. Una dey sabi form. Una wan make me speak pidgin English. I've been trying to speak the Queen's English so that we all can flow together, but una no dey answer me. Somebody says, Doctor, I no know. Florence on TikTok says she's not aware. Mr. Uche Emmanuel, is it Mr. or Mrs.? He said typhoid fever is a bacterial infection. Correct. So let's start. Typhoid fever, number one, is a bacterial infection. This I know I know nothing. Oh, okay, no problem. No problem. Let's move. Typhoid fever is a bacterial infection. Number one. This bacterial infection is a life-threatening infection, meaning that if you do nothing about it, you can you can see Jesus. You can travel, you see Jesus, and you don't come back again. So it is a bacterial infection, a life-threatening bacterial infection that is seen in developing nation. Typhoid fever is not seen in developed nation. It's common in developing nation. Why? Because of hygiene. Somebody on TikTok says typhoid fever is a bacterial infection that can spread throughout the body, affecting many organs. Oh, are you right or wrong? We'll find out. So I have told you about typhoid fever. I've told you about it. Let me see. Wait, I'm trying to bring up somebody. Yes. So I have told you right now. Now, who can get infected or affected by typhoid fever? Who? Anybody. Whether you are a man. How far now, Tessie? How you dey? Whether you are a man, you are a woman, you are an elder, or you are a child, or you are a young lady, a fresh guy, a fresh lady, or you are fat, you are slim, you are tall, you are short. Anybody can be affected with typhoid fever. You dey follow me, abi? Make I speak pidgin English, or should I continue like this? Anybody can be affected with typhoid fever. As a matter of fact, typhoid fever is common in areas with poor hygiene, areas with poor sanitation, common in developing nation, common in resource poor areas, in low economic or low socio-economic society, meaning that in areas that they are not really doing well. That is where you see typhoid. Oh yeah, now later. Are you with me? If you are following me, say uh-huh. Yes. Oh yeah, comment now. Why would they look at me? You dey look at me, oh baby. Why you looking at me like talk to me? So typhoid is common in developing nation. But can I say something? because of because of recent development in developing nation, because of more awareness, because of improvement in hygiene, typhoid is not common anymore like previously. You dey follow me? Who is this? Judith, I saw happy new year. Judith, happy new year. Is that you? I saw that. I saw that, Judith. How are you, Judith? Long time. Oh. Yes, one of my runaway, that year, she's back. Yeah, I dey feel you. Go ahead now. Typhoid, please listen carefully to me. I wan speak pidgin English, oh, but dey come from my mouth. I don't know why. Typhoid is not as common as you have made it to look like now. Previously, in the early days, in the early 1990s, in developing nation, typhoid is common, was very common, but it's not as common as you have taken it to be right now. Are we together? Talk fast, data cost, no vex, my brother. If you no get data, comot for here. No vex. We know na people wey get data dey watch us. No vex, go sleep. No vex. Now, wetin dey cause typhoid? What are the causes or what are the risk factors? Number one, typhoid is caused by a bacteria, not mosquito, not not sunlight. It's a bacteria. And the only way you can get typhoid fever is when you eat something or you drink something that has the bacteria inside. If you eat food or you drink water or you drink whatever, milk, beverage, and there is typhoid bacteria, what we call Salmonella typhi, inside your food or your water. That is how you carry typhoid into your system. But this bacteria can only be found in certain condition. Where can you find the bacteria? Inside your poo poo. When you shit, you go shit for toilet, as you shit, that bacteria dey enter your shit, e dey your shit. So when you shit, you no wash your hand. That is when you go to the toilet, and then you refuse to wash your hands very well. You just use your hand to clean your, now, your kaka, your bum bum, and then you go eat eba, you eat bread, or you eat salad, or you eat shawarma with that your dirty hand. You have transferred the salmonella from your hand into your food, from your food into your GIT, into your stomach. So the way typhoid fever spreads, the salmonella, that organism, the way it spreads from feces, poo poo, to your mouth. So if you tell me, doctor, I have typhoid fever, it simply means you have gone to eat shit. You have carried shit, that typhoid, that salmonella, into your mouth, to your system. Oh, doctor, I am always sick with typhoid. Every time typhoid. You are telling us that every time you are eating shit. You feel me, right? You feel me, Abi? Are we together? If you are following me, say Oh yeah, come comment, abeg. I want to know that you dey with me. You dey follow me, Abi? Now that is number one. Number two, typhoid fever. Eh? I thought it's only dirty water. No, sir. It's not only dirty water. Your food and your water. And then you see typhoid fever in dirty environments, people with poor hygiene. You are cooking food for people, and anytime you go to the toilet, you don't wash your hand. You can share typhoid to a whole community. You can give typhoid to a whole village, a whole society, just you that prepared food. So anybody who handles food is supposed to be very careful. That is why we tell you, when you cook, make sure you wash your hands before cooking. And that is why those of us in the food industry, there's what we call food handlers test. This food handlers test is a test to know whether you have it inside your system. Now let me shock you. Let me shock you. Please listen carefully. There are some people, they can have this bacteria inside their system. We call them carriers, chronic carriers. These people will not come down with any sickness, will not come down with any problem of this typhoid, but they have the bacteria in their system, and these people can transfer it to you. That is why if you are in the food industry, we always carry out what we call food handlers test to know whether you that are preparing food, you have it in your system. The very first woman who had typhoid in this world, this woman, she was cooking food for rich men in the early 1880s. She was cooking food for them. So any family she cook for, somebody will fall sick, somebody will kpai. Any family she cooks for, somebody will fall sick, somebody will kpai. They now invited experts. They were now investigating. They now traced to this woman. They say, madam, you are the cause of the problem. So they told her, stop cooking for people anymore. So this woman ran away from that area. She went to another area. After a long while, she went back again to start cooking for people. The same thing happened again. So they investigated and found out that inside her gallbladder, this woman had salmonella inside there. They were just staying. So you can have the bacteria in your system without any sickness, and you can be transferring it to people. Yes. Are we together? Now, what are the symptoms of typhoid? What are the symptoms? The symptoms of typhoid fever. Number one, fever. I want to be very fast because of time. Fever, headache, body pain. Oh my God. Hello, hello, please. Hello, please. Me and my people, we are here. Thank you. God bless you. God bless you. Okay, so fever, headache, vomiting, diarrhea, you're feeling weak and tired, and it continues. Now, if you don't do anything about it, that person can lose his or her life. The very important thing I want you to know is that typhoid and malaria, they are not brothers and sisters. They are not brothers and sisters. Africans have been deceived a long time ago that when you have malaria, you must have typhoid. Ah, doctor, I have malaria. Okay, but what about typhoid? So who told you that when you have malaria, you must have typhoid? Ah, doctor, you treat me for malaria, you not treat me for typhoid. Why? That is false. They don't go together. As a matter of fact, if you don't do anything about typhoid, you can lose your life. You can you cannot spy, can buy you. Eh? Please, we are talking about typhoid fever. Any question that is not related to the topic, we will not attend to that. Yeah? Good. Now, so what else again about typhoid? How do we know you have typhoid? Number one, you can't diagnose yourself of typhoid fever. Listen to me. Read my lips. You can't. You can't diagnose yourself. Hello. You can't diagnose yourself of typhoid fever because if you have typhoid, you won't even have I've given birth, doctor, and my baby is okay. Congratulations, congrats, huh? Congrats. If you have typhoid, you can't meet your doctor and say, doctor, I have typhoid. Because the people with typhoid fever, they are always very ill. You can't come to the clinic and say, doctor, my sickness, I'm having headache and cold. Now typhoid they do me. No. If typhoid catch you, you will never in your life pray again to have typhoid. You dey follow me, abi you no dey follow me? You dey follow me, abi? So how do we know you have typhoid? Number one, you speak with your doctor. You speak with your doctor, not sitting down in your house and saying you have typhoid. Number two, your doctor will examine. Number three, your doctor will now tell you to carry out some tests. The type of test, number one, not wide out test, not that rubbish test you used to do. That test you do for typhoid, doctor, they say my typhoid is high. I have 1/120, 1/140, 1/160, 1/180. They say my typhoid is high. That's nonsense. And if you know you are among those who always request for that wide out test, I don't know why you still doing it, because the test is outdated. It's old. We don't use it anymore. And if you're a medical professional, like you're a medical doctor, and you still dey request for wide out test, guy, you dey F up. You dey fuck up. As a medical doctor, you no suppose to dey do olden practice. You suppose to dey move forward. What about those wideout tests that used to show 160 over this? I just mentioned it. I said it's outdated. We don't use it anymore. Why? Because there are so many conditions that can give you the same results. Even malaria. If you have malaria and you carry out a wideout test, you will still see the same value. If you have other conditions, there are certain viral infections you will have, and if you do the wide out test, it will still show as if you have typhoid. And that is why research has shown that you shouldn't do wide out anymore. But the shame and disgrace and embarrassing stuff we see every day is that some medical professionals are still doing it. Honestly, I won't lie to you. Some medical doctors are still requesting for what? For typhoid test, the wideout test. Na shame, I no go lie you. I'm starting with doctors. Oga, I dey talk about typhoid first, leave Turner syndrome first. So medical doctors are still requesting for typhoid, and it is not encouraging. Now, after medical doctors, some laboratories, some lab scientists, whenever you go to them, the first thing they do is they will request for what? For wide out. The wide out test is outdated. It gives you false positive results. Dr. Israel is in the house. Let me bring up my co-host. let me bring up my co-host so that he can continue from where I stopped, because we have spoken what is typhoid, we have spoken about the causes of typhoid, we have spoken about the symptoms, and now we are talking about how to make a diagnosis of typhoid. Dr. Israel, oh, you people are also carrying out my live stream with me. Hello, Dr. Israel, good evening. How are you? Okay. Um, okay, so do you understand what I'm talking about? You are not supposed to do the wide out test. So which test do we now carry out for typhoid if we want to know you have typhoid? Number one, blood culture. Blood culture. Number two, stool culture. Stool culture. In severe cases, they can check a bone marrow. They can take your bone marrow for sample. Somebody says they should stop producing the wider reagent then if it's not giving positive results. So this particular comment you have made will not work, because the company that produces the reagents are not in Africa. Number one, most of them. Number two, they make other use of those reagents as well. But the problem is the people who use those reagents for typhoid, for whiteout. Imagine somebody comes to meet me and say, "Doctor, I have typhoid. This is my result. They say my typhoid is high." And I ask them, "Who sent you for this?" They say, "No, I just go do my typhoid test by myself." They tell me say my typhoid high. There's nothing like high typhoid. So is that you have typhoid fever or you don't have typhoid fever. But doctor, now anytime I sick malaria, I always sick typhoid. Listen to me. If typhoid hold you in your life, you will never ever wish to have it again. It can lead to death. It can lead to operation. It can lead to perforation. It can also affect your kidney. It can lead to organ failure. Ma? No, that one is more common with malaria, sha, but yes, it can. But so the way Africans, the way you have made this look like typhoid is one common, one easy. If e catch you, you go suffer oh, you go suffer oh. So please stop trying to embrace typhoid as if it's the only sickness. What if your sickness is hepatitis? Doctor, every month I dey always treat typhoid. There's a problem with you. Very soon you might lose your life because something else is causing the problem. Are we together, right? Okay, now how do we now manage typhoid? How do we treat typhoid? Dr. Israel is supposed to join us, but he's having network issues, so he's not here. So now, how do we treat typhoid fever? I beg you in the name of God, you don't treat typhoid on social media. You can't. You can't treat typhoid on the internet. Do you understand what I'm talking about? Anybody who says if you have typhoid, just go and buy this medicine, that person, until proven otherwise, is a quack. Because the true medical doctors understand that typhoid is not a condition we joke with. So if you have typhoid, most likely we're going to put you on admission. Most likely we're going to give you antibiotics. And these antibiotics through your veins, most times IV, most times. In severe cases, they might add some other stuff for you. So if somebody now says you have typhoid, just go and buy ciprofloxacin, you will unalive yourself. I'm being passionate about it because I have seen it. And our people, they don't like to hear word. Very stubborn individual. Then later they will come to the hospital and start begging you, "Doctor, help me now, treat life first now, forget about money." As if the doctors and the hospital, they don't need money to buy those medications for you. So it is better you listen carefully, that if you have typhoid, please hurriedly go to the hospital. They will diagnose you, they will give you medications, and with the right medicines, you are fine. Antibiotics, you are fine. But we have noticed again that most times Some people have developed resistance, meaning the antibiotics no longer work. You have abused all the antibiotics. You know too much. You are the doctor of yourself. Any little headache, any little cold, you drink antibiotics. So right now that you need the antibiotics, it's no longer working for you. Dr. Israel, good evening. How you doing? Dr. Israel, can you hear me? Network issue. Hello? I can't hear you. We can't hear you. So I'm trying to bring up my co-host on Facebook and YouTube, but I can't seem to hear you, and I don't know why. I don't know why. I don't know why. Okay. Okay, yes, 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 yes. How far? Talk to me. Oh God, network. Dr. Israel, how far now? Hello. Oh my God. I can't hear Dr. Israel. Oh. The network is so bad. Dr. Israel, how far now? Talk to me, talk to me, talk to me. Oh God, I beg. It's okay, it's well. He's having issues with his network. Now, after treating you for typhoid, you are fine, you go home. How do you prevent typhoid? If you have any questions for me, for us concerning typhoid, you can drop your questions in the comment section and we'll respond to you. If you have any question for me, you can drop it in the comment section and we would respond to you. Jesus, I have a lot of questions on Facebook. So let's see. Let's see. One thing I see about this typhoid, they finish. Wrong. Somebody made a comment about typhoid here. So let me address so many comments. Mr. David, Mr. Dave, Mr. Upong Dave, you are wrong. I mean, you are totally, absolutely, blatantly wrong. If you treat typhoid, e go finish. If you dey treat typhoid every time, my guy, number one, you dey treat nonsense. Na you dey treat yourself. If you dey treat typhoid every time, e mean say you dey chop shit every time. If you dey treat typhoid every time, e mean say maybe you dey do the wrong test. So if you treat typhoid well, e go finish. Me wey dey follow you talk for over 20 years or more than that, I never treat typhoid. I have a lot of patients wey never treat typhoid. So typhoid dey finish if you treat am well. Um um Typhoid is very dehydrating. Yes, it can make you vomit. So you can vomit, you can pass watery stool. Yes. Okay. There is a friend of mine who is mostly very sick, that each time she goes to the hospital and the test for typhoid is done, it's always positive. Please, please, I have mentioned before, the test for typhoid is actually culture test. Is not that test we always talk about. Yes. Which one is wider test? I have mentioned about it. It's olden days test we use to make a diagnosis of typhoid. But right now, we don't use the test anymore because the test will give you false positive results. False positive. There are other sicknesses you can have. And if you do the wideout test, it will still show you as if you have typhoid. Ifoma, okay. Dr. Israel, can you hear me now? Um, Hello. Dr. Israel, I can't hear you. Oh, God of heaven. I can't seem to hear him. I don't know if anybody can hear Israel. Um, Ngozi on Facebook. Ngozi Ebuka says, why isn't typhoid vaccination discussed in Nigeria? My doctor in the US administered the vaccine some time ago, and I was surprised because I wasn't aware of it. The vaccine is available, but not so the vaccine is present in Nigeria, but not readily available everywhere. Yes, it is present. Now, you can't compare Nigeria, Ngozi, and the US. Huh? You can't compare in every ramification. You can't compare with manpower, with resources, with medication, with vaccine, with government support. You can't. With hygiene, you can't. But yes, the vaccine is available. Dr. Israel, how far now? Um, watching you from Kaduna State. I'm always having typhoid and malaria. What could be the cause? What should I do? I have said it before and I'm going to say it again. You cannot be treating typhoid every time. Who they treat you? Network is messing up with Dr. Israel. Come, ladies and gentlemen. When I come on social media, I know they like hype myself. Sure you get. I just dey teach you and I disappear. But anybody wey dey treat you for typhoid every time, typhoid, run away from that person. They want to buy you. Typhoid is not a diagnosis you joke with. You can't. It's not like headache. It's not like headache. How will you be treating malaria and typhoid? Who told you that you have malaria and typhoid, my dear? How? So it is abnormal to be treating malaria and typhoid. Something is wrong somewhere. Either na you dey treat yourself, you dey go see quack, or dem no dey really know wetin dem dey do for you. Let's see. I'm taking notes. You are asking me about immune system. Sorry, we are talking about typhoid fever today. So we are not talking about immune system. Let me see. Somebody's asking me a question on TikTok. Let me see the question on TikTok. Doctor, we Nigerians, we don't know the difference between typhoid and malaria. Typhoid is caused by bacteria. Malaria is caused by parasites, plasmodium, mosquito. Mosquito, now they give malaria. Shit, poo poo. When you go chop shit inside your food, when poo poo enter your food, you chop am, you go get typhoid. Sunlight no dey give typhoid. Mosquito no dey give typhoid. You dey hear me so? Water and food, when you chop food or you drink water and that bacteria dey inside, you carry am enter your body, na so you take dey get typhoid. No be, dem no dey go together. Malaria and doctor, now how will you be giving me only malaria medicine? What about typhoid? Shut up. Where did you learn that thing from? Who teach you? Oh baby, abeg now. He's wrong, honestly. But the truth is that, let me tell you one truth. Let me tell you one truth. Africans, we no dey like truth. We like people make dem dey lie give us. As I don tell you this truth now, you no go like am. Na person wey go chop you, wey go chop your money, na you dey find. So when I tell you that you are not supposed to be treating malaria and typhoid, you go talk say, me oh, I no get sense. When somebody else come give you plenty medicine dey treat malaria and typhoid, whereas you no get typhoid, na that one you go like well well. And na so dey take dey chop you, take dey chop you. There is vaccine. Yes, there is vaccine. Yes, there is vaccine. There is. So na so e dey happen. What can we do so we will not get typhoid? Number one, anytime you go to toilet, you go and poo poo, please wash your hands properly with soap and water. Number two, when you want to eat, please cook your food very well. Number three, if you are going to buy food outside, you will eat on the roadside, ensure that the person that is cooking for you is also hygienic. No dey buy food for mama put go just carry her pikin go shit for near where she dey cook. She go just use her hand pack pikin shit, clean pikin shit, start to dey sell food for you again. You have to be very careful. And then improve your hygiene. Ensure that your soakaway, where you shit, where you dispose of your feces, is not close to any water body, is not close to where you cook. Are we together? And if you notice you have any of these symptoms, also speak with your doctor and then you can get vaccinated. Yes, Ifeoma is listening to me. Um, let's see. Okay. Doctor, it is believed that typhoid is effectively treated only herbally. How true is that? It is believed by who? Who believe am? Mr. Man, where did you get that belief from? Africans, show me evidence now. Oh baby, show me. So that until proven otherwise is false. So I have Dr. Chukuma in Dr. Chukuma is here. So we're going to take questions on this and he's going to drop one or two comments. Finally, he's able to join us. Dr. Chukuma, good evening. How you doing? Your mic is open. Your mic is open. Hello.
Yeah, good evening, Dr. Fred.
Guy, why you dey whine
Sorry,
me? On your camera, make them see you. My people want to see your face.
oh, that means I need to go to a place where there is light,
Oh yeah, oh yeah, oh yeah, oh yeah. Help me, help me.
lighted area. Uh, right?
Yes, oh yeah, oh yeah, oh yeah. So the floor is yours. I have spoken about everything about typhoid fever. But there are some very important stuff I want to mention. Please, over to you. Hello. Oh my God, network is okay. So let me take some more questions. Somebody's asking us on Facebook: is there typhoid vaccine? Yes, there is a typhoid vaccine. Can typhoid darken the skin? No, it will not darken your skin. Um, okay, let me see. Uh, okay. We need to take environmental sanitation seriously. Yes, yes, we need to take our environmental sanitation seriously. Is the vaccine expensive? Honestly, I have no idea, Mr. John. Now, let me say something for those who are watching me for the first time. This program, this live session holds every Sunday by 8 p.m. West African time. We have been having this program for more than 5 years right now. For more than 5 years. Every Sunday we are here. So we are not babies on this space. Hmm? Every Sunday, by the grace of God, we are always here. So when you come next week Sunday, you will always meet us here. We don't give our numbers. We don't do private chats. If you have any problem, please go to the hospital. Speak with your doctor. We are not here for you to. I want to private chat you. We are we, no we no 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 we are not here for that. We are here to teach you, educate you, and ensure you get evidence-based information. I know they give my number. No vex. I no get time for that. No vex, I beg. No vex. So if you have any condition, any problem, always speak with your doctor. Sure you understand. And then yes, before I continue, before I forget, I have a course for content creators. A lot of people are destroying their pages. Some of you post my video on your page, you will destroy your page. You don't know anything about content creation. You just believe that to succeed online, carry video post, you will destroy your page, you will get frustrated. So I have a course for you. Get my course. It will help you. You will not suffer. It will guide you. Everything you need to know about content creation is there. It's how to make money with content creation is also there. Get it and you will be glad you did. It is extremely cheap. The link is on my page. Look for the link. Click on the link, get the course, access the course, and you will never ever regret. I'm saying this to help you. It's not so we can't, don't do so. You will destroy your page. My admin will flag your page. You will lose your monetization. You will lose your page. I'm begging you because a lot of you don't know anything about content creation. That is why I'm taking out my time to beg you. Don't do it. Your page will go. I beg you. Please get knowledge, get the course. There are a lot of things that are in the course that will help you. Should you use a Facebook profile or a Facebook page? I mentioned some stuff there. Get it. Thank you. Now, as we round up tonight, let me take some more questions. I saw someone today who was asked to do WIDAL, which was wrong in the first place. And to make matters worse, the person gave the patient ceftriaxone even when the titer value was not anywhere near the value at which treatment was done in the past. Something really needs to be done about this wideout. I swear to God Almighty. I swear to God. I swear. Anybody will just wake up, go and do wideout test. And then when we talk to them, they no dey believe us. E be like because we dey on internet, we be jobless people, we no get work. E be like we no know wetin we dey do. No, stop it, abeg you. I dey beg you o, I dey beg you, abeg. Okay, and let me see. I have learned something tonight, which we can't be treating typhoid every time. You can't, honestly. Doctor, what of those that take ciprofloxacin for typhoid? Is it the right drug? Okay, now listen carefully. You should not listen. You should not be taking ciprofloxacin on your own. Number one. Number two, if indeed you have typhoid, currently ciprofloxacin now has a very high resistance to your salmonella. So anybody who is giving you ciprofloxacin for typhoid, the person is playing with you, because if you truly have typhoid, ciprofloxacin will not work. Listen to me, cipro will not work. And then if you keep abusing antibiotics, the day you have typhoid, antibiotics will not work for you. You will bite your way. Honestly, you will bite your way. So all those ciprofloxacin you are buying for typhoid, you are just wasting your money, because when the true typhoid hold you, your cipro your cipro na water. Cipro na water. Um is there any herbal remedies for typhoid treatments? For now, e no dey. The true typhoid wey go burst person intestine, if e hold you, no herbal medicine go cure am. And the funny thing is that all these herbal guys, they no dey like am. They dey like vex when we talk this kind thing. If the real typhoid hold you, all this your herbal medicine wey you dey drink, e no go work. um Is typhoid contagious? Yes, it can be spread from one person to another through contamination of your food and water. Yes. Okay, so I have mentioned how we can prevent typhoid. Okay, una no share dis live session o. Jesus Christ of Nazareth. Which kind wahala be dis? I just followed you. Thank you for following. You're welcome. Doctor, I really commend you for your time and teaching. Dr. Agu. Dr. Agu, I salute you. MBBS Nigeria, Nsukka, right? I greet you, Chief. Um, let's see. Yes, so we want to see your face. Yes, yes, yes. Okay. Now, please, guys, the way I dey beg you online, listen to me. The way I dey beg on internet, if you meet me one on one for treatment, I no go beg you o, I go collect money o. Let's listen carefully. See the way I beg you, make you no fall sick. Prevention is better than cure. If you come to the hospital, you come for private consultation, you go pay, and we no want make you spend money anyhow. Na im make we dey beg you. Is that okay? Is that okay? It's fine, right? Right. Now, any questions? I have to go. My time is almost up. My time on the live session is almost up. Tell me, doctor, we are your fans oh. Na I go collect your money for consultation. I no dey do fans oh. Doctor, I am your fan. I follow you online. Please now, don't collect consultation. You dey play. You will pay. You will pay. My doctor, I salute you. Yes, so good life na sense. Wait, when it turns again. Okay. But honestly, um, there's a difference between teaching people and then consulting. Sure you get. So please, all this information we are giving to you, we are not just talking because we just want to talk. We are talking because we want you to take charge of your health. Okay. More questions, more questions. Let me see if I have questions here. Let me see if I have questions here. Um Yeah. When treated malaria refuses to go, coupled with serious headache, then we conclude that it is typhoid. Wrong, wrong. That is not how we conclude typhoid. We carry out tests. We carry out tests. Okay. Let me see. Good evening, Juliet Richard. Welcome, welcome, welcome. Okay. Vivian, I see you. Let me see again. Which other one? Who they here? Who they here? I'm looking for all your comments. You people are not sharing this live session, oh. Later now, you'll be disturbing my life, my blockers, my this, my that. E clear, abi e no clear? E clear, oh. Now government we go beg, make them sanitize environment and educate our children from young age. Yes, I agree. But at the same time, we can't wait for the government. We also need to do our own. Hello, ma. Hello, ma. The live session is speaking your voice, ma. Thank you, ma. Yes. So, let me see. Yes, government needs to bring back environmental sanitation. Our environment is very dirty. Our people are dirty, very dirty. Poor hygiene. People go to the toilet, they don't wash their hands. They don't take care of their food and water. Somebody is asking me a question. Can you do me a favor? Make a video on the brain, why we need to take care of our brain, effect of alcohol, and why we must get a good sleep. I have done that already a long time ago. Mr. Rahim, I have done that a long time ago. Yes. Let me see. Poor man no fit prevent typhoid, sha. Na only God dey protect us. If you don't have money, no, now my guy, you can prevent typhoid. Listen to me. No allow anybody deceive you. Hygiene, my guy, wash your hand when you go shit. After you clean your nyash, eh, wash your hands. When you want to eat, wash your hands. When you are cooking, cook your food well. Cover your food. No, that's not madam, that's my mom. Hmm? My mom. You want to see my mom? My mom is here. But no, you will not see my mama. Yeah. But my wife is inside, huh? Yeah. Okay, dirtiness is the reason for typhoid. Yes, one is dirtiness, two is ignorance. One is our people are very dirty, honestly. Um, Dr. Fred, thanks for your teaching. God bless you. So help me share. And then again, we dey eat anything we see. We drink the type of water we see. True, I no go lie you. I no go lie you. Our people need, mama, we greet you, ma. Mommy, they are greeting you. We are greet them. Say I greet you too. Yes. They've heard you. Okay, good. So honestly, as Africans, we need to take charge of our health. You see the way I dey beg you. Listen, guys. You see the way I dey beg. You look like say I no know wetin I dey talk. When sickness enter, this beg no dey again. Oh. At that point in time, na how to help you, money for medication, and so many stuff. That is why we are taking our time to ensure that everybody take charge of their health. Wash your hand, ensure you cook your food properly. No lose guard, no lose guard. Good. Any final words? Dr. Israel could not join us. Dr. Israel, network is bad network. We dey struggle with network here. And then finally again, for those people who are content creators, listen, na me dey talk to you, na me dey show you my face here. Get my course on content creation. Number one, you no go regret. Number two, you go dey glad say you get proper guidance. Now the course is in pidgin English. It's in pidgin English. If I have time, I would make another one strictly in the Queen's English. Shey you get? So if you know you are on social media, you dey post, you want to grow, you want to make money, you want to build your personal brand and a lot of things. There are many courses on the internet. You can get them or you can get my course. I'm very particular about it so that you don't suffer, so that your page no go scatter. Get am. And if you want to get it, you can't get it, you can send an email. My email is here. My admin would respond to you. My admin will respond to you and give you the account to pay and give you access to the course. Do you understand? Get it. I'm very serious. If you don't get them, no problem. Where is Dr. Israel? Dr. Israel is having severe network issues. Dr. Israel and Dr. Chukuma were supposed to join us, but the network was not on their side tonight. They were supposed to join us today. Yeah. Okay, let me see. Boiling water can help reducing. Yes, boiling your water can also help you very well. It can help. Let me see. I'm almost out of time. Don't forget, this program hosts every Sunday by 8 to 9. We have been here for more than 5 years, and God has been helping us. Let's see. Every Sunday. For those who are not aware, we are licensed medical doctors. We not still the doctor title. So when we say we be doctor, it means say we earn the title. We work hard for am. You can verify. You can go to the Medical and Dental Council of Nigeria and verify. Tell them about my name. They will confirm you. Doctor, I go join the course online. The course. Yes. Click on my link here. The course dey there. You fit buy am, watch am anytime, anywhere you dey, you go get am. Very cheap. You'll be glad. Okay, any final questions for me on this stuff? Any final questions? Let me see. My people on Facebook, share this live. Share this live. Leave Nyash alone. This typhoid education should be repeated periodically, and hopefully, people will share this to help reach our community. Yeah, we keep trying, and God will help us. Yes, health is well, no lose guard. Oh, I wish I can pin your comments, Ifoma, but I can't. I've seen the video on brain. Thank you. Okay, you're welcome, Mr. Rahim. Especially Lagos state environment is very dirty. Now, let me talk about it. Lagos is not doing well environmentally. I know that the commissioner for environment is trying. I think it's Mr. Tokumba Wahab. The commissioner for environment is trying, but we need to do more. Lagos is very, very dirty, and our people need orientation. We need to talk to them on radio. We need to talk to them on TV. We need to talk to them in the marketplace. We need to talk to them on social media. People need to know how to dispose waste product. People need to stop defecating anywhere. Our environment needs to be clean. If your environment is clean, you have defeated sickness in about 50%. And let's see, doctor, if you see the kind of dirty food poor people eat at village cause of lack of money, you will know it's only God. I agree with you. But at the same time, the people at the village don't fall sick like those in the township. Why? They exercise. Early in the morning, they go farm, they trek, they exercise. Number two, they eat fresh food, my brother. They eat vegetables, they eat meats, they eat fish, food from the soil where dem plant, fresh food. E dey, but na natural form, not the one wey dem import, like cow manure. Or you understand? E dey. So the people in the village, they are very fit. You go see 90-year-old man, 90-year-old woman, e still dey waka fast. Young guy no fit do wetin 90-year-old man dey do. So we can't compare them with ourselves. Our way of life in the urban environment is different than those in the village. So, with what you have said, I want to believe they even eat healthier than those of us in the city. And I have to go now. I hope you have gained value. If you know you learned anything, drop it in the comment section quickly before I go. Ifoma, I see you. Ifoma Ilo, I see you today. I see all your comments. Yes. If you know you learned anything, please drop it in the comment section and share. Let's see. Correct. That's true fact. Yes, it's true. It seems doctor is not answering any other questions apart from typhoid. Yes, today is only for typhoid. My brother, any day we have a topic, we don't go to another topic. That is how we work. I found the great value in your videos. From next week, I will share every Sunday. I want to do everything to encourage you to do more because this is a privilege. You want to encourage me to do more. One way to encourage me to do more is to tell those people that have influence to come and partner with my page. Yeah, that way we are encouraged. That way. But thank you for your kind words. I learned a lot and I'm looking forward for next week. Thank you so much. Florence says, I learned a lot today. Dedication says, I learned much. Thank you. And let's see. People on Facebook. People on Facebook. Let's see. Let's see. That is true. Ruth Ademola, Eclair, Ngozi Ebuka, Good Life in a Sense, Lolo, Blessing, I learned a lot. Ikusika, Samuel came late. Yes, I learned a lot. So thank you for so much for joining, and I appreciate you so much for your time. No vex. This program is always 1 hour every Sunday. I have learned a lot. Even my husband, they here. In fact, we connect you to our TV. Everyone is here. Unwunye Hope. Extend my regards to your husband. I greet you, sir. Husband to Madam Hope. Hello, hello. Thank you so much and have a wonderful night. Like I always say, good life now waiting. Charity. Charity, I see you. Thank you. Good life now waiting. Good life. Nah sense. Take care and have a wonderful night. I'll see you next week. Au revoir. Bye bye. O dabo. Kachifonu. Waiting be bye bye for Charity. Oh, okay. Ochiaho. Okay. For Hausa, waiting be bye bye. I will learn that one next time. Take care. And